Great. That's great. What drew you to specialize in esophageal cancer and thoracic surgery? And because that's a very complex combination, and curious to hear how you knew enough to bring yourself into that.
I think we all get influenced by mentors during our careers and training. I trained both in India, England, and United States, and I liked cardiothoracic surgery, operating on the heart and the lung, and esophagus and other organs within the chest. The heart, as fascinating as it is, most of the time behaves and mechanical function, but the cancer biology and immunology is complex and very challenging. And one of my mentors used to say, take a problem and focus on this for your lifetime to make a difference. That's where you will be satisfied and others will be satisfied. So that's what influenced me to come into cancer immunology and immunotherapy, and working with the great mentors at Memorial Sloan Kettering Cancer Center. That solidified over a period of years.
Flipping that around, Bart, what was
Yeah,
it
I was going to say,
that drove you and Ginny into coming up with the idea of starting a foundation?
it was interesting. When I was diagnosed, I had this problem swallowing, is what caused me to ask a doctor's opinion. Went for an endoscope and they said I had cancer. And I said, cancer of what? And he said, the esophagus. And I said, how could you have cancer in a tube? And he said, well, you do. And when he asked me that was I a heartburn patient, I said, I've been a heartburn patient for well over 30 years, all my business career. He said, and that's what led to your esophageal cancer. And the interesting part of that is when we thought about it, Ginny and I thought about it, we said, gee, how many people in this country know that have heartburn, persistent heartburn, don't know that it can lead to esophageal cancer? And we realized there are a lot of people. So we ultimately decided, after about 2 years of working with Dr. Baines and Dr. Adusumili, we decided to form the Esophageal Cancer Education Foundation, one, to bring awareness, to educate the public, but more importantly, to walk the journey with patients that have this disease. And dealing with Dr. Adusumili, Dr. Baines, and the other surgeons at Sloan Kettering, I was able to see a lot of the patients as they were first hearing about the disease, and was helping them basically cope with the unknown that they were about to experience. And that was it was a 26-year project to do that, and we do that well now. So that's basically what we did.